Hello, my name is Rob Ballard, and the podcast episode that I chose from the AHA Advancing Health Podcast playlist was called Operation Winter Shield, and it was labeled as the FBI's campaign against cyber threats. This episode had a few special guests by the name of John Riggy, which he was a national advisor for the cybersecurity and risk at the American Hospital Association. And then we got Brett Leatherman. He was a FBI Cyber Division Assistant Director. And lastly, there is Gretchen Barrier, the FBI Office of Private Sector Assistant. And the topics covered in this episode was how the nation-state actors are utilizing cyber criminals and AI to help disrupt healthcare. And the second topic that they spoke about in this episode was how the hospitals and health systems are building trusted relationships with the FBI's cybersecurity team before the problem or crisis even happens. This did catch my attention because they start going on to explain the first point into further detail about how the other countries are using their cyber networks to hack into the US system and getting past the firewall and the cyber walls to get into the US technology system. Brett, one of the speakers, he stated a good example of this, and it is called Flax Typhoon. And this is where they leveraged the Integrity Technology Group, which was a company within China that provided certain access to the networks in the U.S. And then for the second detail that they talked about the relationships they have with the American Hospital Association and with the FBI, and they described this as quote unquote a gold standard. What they meant by this is it basically reflects exactly what effective public-private partnerships should look like. And they also talked about how hospitals are the front line for cyber attacks and threats. Hospitals and schools and small businesses get attacked the most through cyber threats. What the hospitals do share with the FBI can help them stop the threats before the damage from the threats spreads throughout the hospital system and throughout the city or state. And Gretchen, in her own words, states that I really think it's the combination of trust, continuity, and real-world impact where we're collaborating on reports or real-time threats. That is why I consider this a golden standard. And lastly, I would like to talk about the relationships between the hospitals and the FBI. The FBI gets mostly involved with the hospitals when the hospitals reach out to their local FBI field office and they begin asking for a private sector coordinator. So they have to make a phone call or email them and get their attention and explain everything that is happening and try to get some help. And then John, one of the other speakers, states in his own quotes that the FBI is always predisposed to help. And I think that's very important to notify throughout this podcast or this episode because the FBI is not a regulatory agency. It's not just a agency where you can walk in and just say you have a problem and basically ask for help. You have to do research. They have to do research on this, on the problem or the system. They need to figure out what is going on, who is hacking the hospital or the system. And the FBI's job is to help you or help your company, your hospital, your school recover from the attacks and provide assistance during the attacks. These ideas did change my way of thinking on this topic because I had no knowledge of this topic. I knew that there were ways of protecting the front lines of healthcare, but I had no idea if it had something to do with the FBI or if it was other U.S. services like basic police force or like the actual the government, like the White House and stuff like that. And the question that this podcast raised for me is there other U.S. agencies that partake in the prevention of the cyber attacks? Is it just the FBI? Is it cyber walls? Is it new technology? Is it creating cyber walls to hide personal information? And are there other ways to help prevent this? Is it just an FBI problem? Is it just a cyber wall issue? Or is it just people not hiding their information well enough? But that concludes my video, and thank you for watching.